Well, several African countries have recorded their first or index cases of the coronavirus. Kenya has banned all public events after a woman who returned from the United States tested positive, while Ghana, Sudan and Gabon have confirmed their first cases. In Ethiopia, a 48-year-old Japanese man tested positive after arriving in the country from Burkina Faso. Algeria has closed schools after its first virus death, and Burundi is enforcing a 14-day quarantine period for travellers. Here at home, 8 new cases have been reported, bringing the total to 24. Now, to discuss this, we're joined via Skype from Brazzaville in the Republic of Congo by Dr. Michel Yao. In fact, we have him on the phone. He's Program Manager for Emergency Response at the World Health Organization in Africa. Doctor, thank you for being with us. There was a window period when African countries were being urged to prepare. With cases in so many countries now, is that window gone?
This window is really narrowing, and because we have cases in Africa, and even in some of the countries we start having local transmission that can lead to a wider transmission within the community, and that can become a big issue for most of the African countries due to less capacity in terms of treatment of the severe cases, even if there are kind of 14% for severe cases and 5% for critical cases from what we are seeing in Europe and what we saw also in China. So this window is narrowing, and it's required a kind of involvement at the highest level in the country to at least a minimum investment. Where we had the big challenge is actually treatment capacity. Should there be an increasing number of cases, and this requires, at least if these facilities have not been identified and rehabilitated, to preposition items that can allow this scale up if when the situation comes. The other thing that should be in countries is to strengthen the screening process. It should not be only temperature taking, but we should have a comprehensive surveillance system that can monitor people coming from high risk and detect earlier cases, and also ensure that the capacity to manage them properly when they are identified and confirmed.
Yeah. Well, firstly, I mean, to contain this, should African countries think of travel bans, of stopping people coming and going from Europe, where Europe has been the area from which these cases have been imported?
What countries should do is the travel ban is not a formal recommendation yet from WHO, because from experience, it's African countries that will suffer most, mainly in terms of supply that may require should there be an increasing number of cases in the country. Because the borders are porous, and closing the border cannot guarantee that any case won't be imported in the country. However, the people coming from this country should be monitored. Our advice is that if countries have to do the quarantine, is that they have to ensure that they have the appropriate means in terms of where people will stay, in terms of people ensuring monitoring of the healthcare, and they have also a response capacity should there be cases among people under quarantine. Yeah. If they cannot have the quarantine facility, is how to do a safe quarantine. And the safe quarantine also requires a bigger team to monitor these people daily to ensure that they cannot turn. It's a bit of contact tracing that we do in some of the countries of Ebola. So it may require many volunteers involved. It may require many partners involved around the screening that alone is in terms of temperature checking or any symptom checking may not be effective. Most of the cases in Africa came in asymptomatic and became sick in the country.
Down the line, though, what does coronavirus mean for Africa? So there's concerns about countries with weak infrastructure, weak healthcare, many of them in Africa. Add that to a high prevalence of HIV and TB. Those people are particularly vulnerable. Could this be devastating for our continent?
It could be. And actually, it's one of the things that we are trying to, we are working in. We are trying to involve more scientists to analyze and do some modeling. But from experience in China and in Europe, it has been seen that people that have what we call comorbidity, that another disease, are more vulnerable. And you have the factor also of elderly that are also vulnerable. But in Africa, it should be about corona, but it will be about other diseases. If we imagine a whole health facilities being flooded by people suffering with the respiratory distress that they need assistance, of course, the hospital will not be able to manage people coming from obstetrical emergencies, people coming for severe malaria. This can have also another death toll in addition to what coronavirus may cause. So all this together, the scenario is how can we stop it at the entrance, or how can we manage the sporadic cases to avoid that we jump into crowded communities around the big cities in Africa.
Yeah. Well, very quickly, you spoke about more than just screening at the airports, and testing kits are required in the first place to detect the disease. It still takes a while. The fast ones, those test kits will need to be bought en masse. Can African countries afford it? Are they available? The rest of the world is looking inward, and maybe not too worried about charity right now.
The testing, actually, it is not advised from what we have, and there is not enough in the market. Of course, WHO is trying its best. We supply countries. We are trying to send in the coming days a second batch, but all the international supply chain are overstretched. So these testing have to be used rationally. So this is also require, of course, some solidarity. It's some countries, including even China, that were able to overcome this big challenge by supplying all the lab of this support is required. And most of the African countries have now a response plan, and they are now appealing for funding. I know that the World Bank, the African Development Bank, and so on, have started pledging funding. But all this needs to be faster. If not, it will be too late to react when we will be flooded and when it will be emotionally intense with a lot of stress, a lot of political issues. It will be difficult to manage.
All right, so there's still a window, but it's closing. That's the word from the World Health Organization Program Manager for Emergency Response, Dr. Michel Yao.